Hey everyone, first I wanted to thank everyone for joining our webinar today. Daniel and I are excited to be here. Today we'll be focusing on telehealth and how ScriptDrop works to help streamline the process for both the patient and the provider.
So for anyone that isn't as familiar with ScriptDrop, we're a healthcare IT company really with the goal of improving the prescription delivery process just to keep patients healthy and on therapy. So now the way that we actually accomplish this is just by providing pharmacies and healthcare providers with the technology they need to improve the process while also connecting them to our nationwide courier network. So here we actually highlight just a subsection of our pharmacy partnerships. Our network extends far past this and really includes additional pharmacy chains, health systems, and community pharmacies. Right now, we actually offer prescription delivery to patients in all 50 states and likely have pharmacy partnerships right near you. Now, before we dive in too far into the webinar, just wanted to make sure to introduce myself and Erin. So my name's Daniel Dalton, and my main focus in the organization is really working with a lot of our strategic partners just to really allow them to launch a delivery solution with their patients directly. And I'll pass it over to you, Erin.
My name's Erin Simmons, and I'm a technical account manager at ScriptDrop. I mainly focus on setting up integrations with pharmacy chains, pharmacy management systems, as well as any other integrations with ScriptDrop.
Okay, thank you so much, Erin and Daniel, for the awesome intros. And I'm going to hand it back over to Erin right now to talk about the rise of telehealth and what that really means.
Yeah, so I'm sure most of you are very, very familiar with telehealth by now. With the current situation, since the spread of COVID-19, telehealth's become increasingly popular. However, just to provide a little bit more background, telehealth is the use of electronic information and telecommunication technologies to support long-distance clinical healthcare. Telehealth can also be administered through video conferences, the internet, store and forward imaging, as well as wireless connections. So I know we touched briefly on COVID-19 and how it's affected telehealth. Telehealth has extremely skyrocketed, 11% usage in 2019 to 46% usage currently. Providers have also become increasingly more comfortable with the use of telehealth. And most people believe that this is due to the increased demand from patients in the last several months. In turn, this has also changed how government and insurance companies have reimbursed telehealth costs. So, for example, prior to the pandemic, the CMS would only cover telehealth visits in specific regions or for particular circumstances. Once the pandemic has ended, it's believed that the telehealth visit numbers will continue to remain high. Many patients have really realized the time savings and convenience factor of these telehealth visits. So, for instance, a telehealth visit is a great option for those maintenance visits, those doctor's appointments where you just need to go get another prescription, things like that. But on the flip side, there have also been a decrease in emergency department and urgent care visits with patients using telehealth much more.
Awesome. Thank you so much, Erin. So with that, I'm going to hand it over to Daniel to talk about ScriptDrop and how ScriptDrop is going to play a role in telehealth in the future. Daniel?
Yeah. Thanks, Avery. So the main items I'm looking to discuss right now are really just what are some of the challenges that patients face with delivery? How does ScriptDrop actually help out the patient today? And really, how is ScriptDrop and telehealth connected? So for some of the challenges that patients face today, with everything with coronavirus and telehealth being on the rise, prescription delivery isn't necessarily a new topic or a new hot topic in the industry, but the demand rose rapidly because of coronavirus. And this really led to a lot of patients actually seeking prescription delivery for the very first time and really not knowing actually how to get their prescription delivered. Now, one of the first places that patients really check to get their prescription delivered is naturally just with their preferred pharmacy, just the pharmacy that has their prescription. Oftentimes, though, if that pharmacy actually doesn't offer delivery, that means the patient would actually need to transfer that medication to a pharmacy that does offer delivery, which can really be a pretty tedious process for the pharmacy and the patient. Now, let's say that delivery is available at that pharmacy. Oftentimes, it could be more like a mail order process, through USPS, for example, and it can take a few days for the patient to actually get their therapy. And a lot of the time, that's going to be fine. Other times, the patient may not be able to wait 2 to 3 or even more days for their medication. And this really led to a lot of patients actually looking at online pharmacies as well. And in these cases, some of the issues with the patients are they're really not as familiar with the concept of online pharmacies because it is a little bit newer for them. But also, some online pharmacies only really deal with certain drug types, so the patient may not be able to get their medication delivered that way as well. So that kind of ties into, how does ScriptDrop actually work to solve some of these problems to actually help aid that patient? So we actually built out just a patient solution, and we really wanted to make sure we were tackling all these issues. So we have a uniform platform where the patient can request delivery from any pharmacy in the country that's within 5 miles from their house. So they can initiate that process right through the ScriptDrop website. We highlight the workflow right here. And really all the patient has to do is just enter in their demographic information, what pharmacy they want it delivered to or picked up from, and then they pay for the delivery. At that point, ScriptDrop actually communicates directly with the pharmacy just to let them know that the patient did request for their medication to be picked up and that the driver is going to be coming to pick it up. So this actually allows the patient to keep their preferred pharmacy, but it also really gives them a lot of really significant convenience. So since that medication is going to be delivered either the same day or the next day the patient places it, just based on what time they actually submit the delivery request, it also allows the patient to stay at home and healthy during coronavirus. In addition to that, we really want to make sure to make really just security a top concern. So anytime the medication changes hands from the pharmacy to our driver picking it up, we do record the timestamp and the chain of custody. That way, if the patient has any questions, they can always reach out to our great support team, and we're more than happy to answer any questions they have, from statuses on their delivery to even information on how they can place their first order. Which just kind of leads me right to my last point, really kind of connecting everything together. So how is ScriptDrop and telehealth connected? So in my opinion on really where everything's going, so delivery and telehealth are pretty perfectly aligned. With telehealth, you already have patients really using technology just for added convenience, so they don't need to go into the doctor's office. Similar with delivery, the patient can use technology to not have to worry about going into the pharmacy after that telehealth appointment, or really any doctor appointment, or really any medication they have. This helps improve patient adherence. So oftentimes the patient will fail to actually pick up that first medication or even a refill. And this could be for any reasons, but a really common one is actually just the fact of convenience. If you can actually bridge that gap for convenience and take that medication right to the patient, they are much more likely to stay on therapy. And then lastly, delivery really gives telehealth a significant advantage, and really competitive advantage over their competition, because that field is always constantly innovating and changing, and delivery is really a way they can show that they're keeping their patients healthy, on therapy, and happy.
Awesome. Thank you so much, Daniel. So with that, we are going to end this webinar with a little bit of a question and answer session. So our first question that was sent in is, can the patient request a delivery without a telehealth consultation? Daniel, can you kick that one off for us?
Yeah, I can take that one. So
Okay.
absolutely. So one of the really great things about our patient-facing solution isn't just that they can really pick up that medication from any pharmacy and get it delivered, but also they could do it with or without, a telehealth visit. So this could be for any new prescription they're just written by the doctor, but it can also be for refills as well.
Awesome. Thank you. Our next question is, are there specific pharmacies that ScriptDrop can complete a delivery for? Erin?
Yeah, sure. So we can complete a delivery for any pharmacy in the country. We do have formal relationships with many, many pharmacies in the US. So a patient can essentially request to have their medication delivered to their home from the pharmacy that same day, as long as it's prior to the pharmacy's delivery window.
Got it. So our third question is, I'm a caregiver and I can't always come to the door to get deliveries. Is there a contact list delivery option that can be put in place? Daniel, do you mind taking this one over?
Yeah, absolutely. Yeah, because of everything with coronavirus, we did have to quickly move out into contactless delivery option. Now, some of our network pharmacies they are requesting for signatures again, but right now we still give the patient the ability, or the caregiver the ability, to opt out of that. So we know that the times are unique with that. So absolutely, there is a contactless delivery option available.
Good to know. Thank you. And our last question, Erin, is, can I use a copay card when I get my prescriptions delivered?
Absolutely. So you're still able to use a copay card. Even if you're having your medication delivered, you would simply just need to call your pharmacy that would be delivering your medication to make your copayment over the phone.
Got it. Thank you.
Absolutely.
So with that, that wraps up our second webinar. So thank you everyone so much for your time, and thank you, Erin and Daniel, for hosting this. Anything else from you two to add?
I think that's it on my end.
Likewise, thanks everyone.